Now that's Dr. Straight up, up, and then turn it towards us a little bit. Other way. Yeah. Okay, Heather, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified about 30 or 40 times on the screen. It's a little hard to see the biceps tendon here because of the rotator cuff tear. Look on the because of the rotator cuff tear, which is right here. So we're going to trim some of this torn rotator cuff just so we can see the biceps, because we're going to be doing what we call a biceps tenodesis here. We'll take the spinal needle. That needle right through the biceps right there. There's a black wire you'll see coming through. I'll show you some more just a minute. Pause please. Because it doesn't look. Okay, now we're going to release the biceps down here. There it goes. And that takes care of that problem. Now we're going to have a look at the rest of the shoulder inside the joint here. We'll smooth out any labral tears or any labral fraying. We'll look towards the back of the shoulder here. And we can see that there's some arthritis on the humeral head. You can see some of the fraying there. We'll work on that as well. First, work on the front of the shoulder here. Rotator cuff. So here's this big tear in the rotator cuff tendon. You don't have an anchor, you can. And next we'll switch positions with your shoulder and get to work on the cuff. So the next thing we show you will be our work up in the subacromial space, working on any bone spurs or anything else we need to clean up before we start repairing the tendon back to the bone structure. Okay, we've just taken off a little bit of bone from the anterior acromion. That's where the bone spur was. And now we're going to go ahead and start to work on this rotator cuff here. You can see the hole in the tendon there. Hold the camera. We're going to go ahead and change positions with our portals, and then we'll show you some more in just a minute. Okay, we're just looking at the tear here. We're getting ready to plan our repair. We're going to try and place one anchor back here and probably a second anchor up in the front. So, hold the camera. We're going to make our first nick in the skin. Using an instrument called a punch, we're going to make a little starter hole in the bone, and you'll see that coming down here. There's a punch. And we'd like to make a little right about here. Okay. And then into that starter hole, we're going to take our first suture anchor and place it down into the bone. There's the screw. ahead and unload the screwdriver next. And that gives us 3 different colored sutures to work with. We'll reach in from the right side of the screen and spread these apart to decide what order we're going to use them. So it looks like we're going to go white, black, blue, starting from left to right on the screen. So we want the white one first, right here. Okay. Okay, and then we're going to take this our first stitch back here. Sure we've got the deep layer of the tendon here, like that. There you can see what's underneath. Go ahead and delete that and load it in just a minute. Pause please. Okay, so we've got this first suture tied. We wanted to do that to give us a good posterior anchor point. And now we can see exactly how the tendon needs to lay down. Okay, here's the needle tip on our second stitch. And just like the first one, we're going to retrieve the wire and load it. This time we're going to load it with that black and white stripe suture. Awesome. Okay, so you can see here we're using the punch to make a second hole for our second suture anchor. Unload that one. That gives us 3 more sutures to work with. We will go off on the video, show you some more in a little bit. Getting ready to start tying the rest of the sutures here. We've got 5 more sutures to tie for the rotator cuff and 1 for the biceps. When it's all said and done, you should be able to get this fixed with 2 suture anchors and a total of 6 sutures for the rotator cuff. And then we've got the biceps tenodesis that we did separately. So this is the second suture for the cuff. You can see how that brings it down to the bone. Reinforce this posterior part of the cuff, we've got a 3rd suture from the first anchor that we're going to tie here in just a minute. First, you've got to clip these suture tails. That. And then we'll go ahead and grab this blue and white suture. And then we'll tie this in just a minute. Pause Okay, we just finished tying the sutures to secure the biceps. We're just cutting those sutures right there. And now we're finished. Here's what's left of the rotator cuff tear. It's completely repaired down to the bone. We'll take a punch and make a couple little vent holes in the bone here. I'll show you that. So, a couple back over here. We do these to try and kickstart the healing process, basically. Okay. And so now we'll go off on the video. So good luck to you now. Bye-bye.